Yeah, absolutely. So I identified des-gamma-carboxy prothrombin as a potential biomarker for treatment response in patients who received first-line atezolizumab, bevacizumab, and had advanced hepatocellular carcinoma. So I conducted a retrospective analysis on patients at University of California, San Diego, identified 53 patients with advanced HCC who were treated with first-line atezo-bev, and we measured DCP on day one, cycle one of atezo-bev, and then we also remeasured it on the day of best treatment response, which was based on imaging modalities. And then we compared the DCP response with the imaging response. So we found that patients who had greater than or equal to 50% response, sorry, we found that patients with greater than or equal to 50% decrease in DCP was considered DCP response. Those patients had an overall response rate of 69% and a disease control rate of 100%. And the patients, conversely, that had greater than or equal to 50% increase in DCP from day one to the time of best treatment response had, unfortunately, 95% no response from the treatment. So moving forward, we would like to correlate these findings with AFP and then also see if DCP correlates with prognostic implications. There are some Asian-based studies that have reported that DCP is a prognostic factor. So it would be very interesting to see if we see that in our own Western population in non-Hep B virus in non-endemic areas. So des-gamma-carboxy prothrombin is actually, so prothrombin is part of the coagulation cascade. Des-gamma-carboxy prothrombin is forms whenever there's an extra carboxyl group that's added to the prothrombin in the environment where there's absence of vitamin K. So essentially it's a mutated coagulation factor that is found primarily in patients with HCC. We don't typically use DCP in patients with other malignancies at present, as far as my knowledge. So I would like to see if it makes a good biomarker with other treatments, other first-line treatments like durva, tremi, and oral multi-kinase inhibitors and things like that as well. I'd love to tease that out in the future. As far as patients with hepatocellular carcinoma, usually the etiology is because of cirrhosis. And in cirrhosis, it's usually an environment where patients are vitamin K deficient. So it creates an environment where des-gamma-carboxy prothrombin can be created. So I would like to see if the particular etiology correlates with our findings as biomarkers. So DCP has, there are a couple of reasons why we have to be speculative about our data, because I need to tease out if our patients had thrombosis. And patients with thrombosis, such as portal vein thrombosis, which is not uncommon in patients with HCC, or tumor in vein even, DCP can rise or be altered because of that environment, because it is a coagulation factor. Additionally, patients with biliary obstruction can have an increase in DCP, and then patients with active hepatitis can have an increase in DCP. So it is kind of an acute phase reactant in some scenarios. So it would be nice to see if we can tease out if DCP is correlated with as a predictive biomarker is correlated with the etiology of HCC, or as a blanket statement, just once you have HCC, DCP is a good biomarker to predict treatment response. Yeah, so I would love to correlate DCP with treatment response with AFP. Then I would also love to kind of see if DCP is going to correlate with prognostic implications as well, especially based on those previously done Asian studies that have found those to be correlative.